before we wrap up the program, this is our opportunity for people in the community and the media to ask questions of the mayor or the mayor's team. Dr. Garcia, I don't know if you want to come up and stage the podium. I will not represent you guys.
What are you trying to tell us, Don?
So I know one of the issues that DC has always had is that there's a lot of people out there who are HIV positive who don't know that they're HIV positive, and hence you guys have put a lot of emphasis on testing. Do you have a sense of number-wise, percentage-wise, how many people out there in the city might not know they're HIV positive?
Well, one of the studies that we're actually releasing today that's about men who have sex with men actually shows that among that population group. And so we're seeing some progress in that respect. So about 3 years ago when we did studies, we showed that there were in many as between 30 to 50% of the people who were HIV positive were unaware of their diagnosis. However, we're seeing progress in that. And our new study today actually shows that about 23% of men who have sex with men in that study showed that they were unaware of their diagnosis. So we believe that a lot of the efforts that we've been conducting in the city around expanding testing, about making sure that people know their status, are succeeding in that there are fewer people that we believe who are unaware of their diagnosis. But that still is our major focus, is to be able to make sure that people are diagnosed and linked to care and treatment. We know now that care and treatment not only ensures that they have healthy outcomes, but science is now telling us that it actually reduces the chances of further transmission of HIV. So we're having double success in both being able to ensure that people live healthy lives and reduce new infections.
I think the emphasis that we've tried to place, on treating the whole person is having an impact too, because it means that we are expanding the number of providers, healthcare professionals, if you will, who are involved. I mean, there was a long period of time when we perceived, that's where you go if you want to be tested for AIDS, that's where you go if you want to be treated for AIDS. Now, with us expanding that, it really has brought a lot of people into the mix that heretofore were not there, and I think it's having an impact as well.
And if we may add, Mayor, we have now an initiative that we have been working right now, it's not in place yet, that when you go to the clinics that we run for STDs and HIV, we will be able to identify the person and then do like assessment of the wellness of that person and then connect it with a community clinic like here. And because in that way, we will not lose patients neither, because it's not only to tell that you're positive, it's also to find out how your baseline in terms of your health. So that's another thing that we're working right now, and it's going to be launched very soon.
Are you guys still running the program where you tested the DMV?
Yes.
Yeah.
Was it, I know when it was run as a pilot, there was mention of expanding it to other sites, DC government offices to give out social services. Was that ever done?
Yes. So we're now also testing at the Anacostia Social Service Center.
Again, it's proliferating, and it's demystifying, also destigmatizing the whole issue of HIV and AIDS, which we know for many years was stigmatizing.
So our efforts is around promoting for, like, when somebody goes for their routine health care, that HIV is included in that regular screening. So we've been working with our medical community of private practitioners, our major healthcare providers, as the mayor said, expanding the number of people who are engaged in making sure that people are screened regularly. Our recommendation is once a year you get a screen for HIV, and that way that people can be identified, and that's how we're able to help find more people who were unaware of their diagnosis.
And you had that aspect, and the other thing is for women that are pregnant, we are not only going to engage the patients, but also the provider. And we want the communities to be very proactive. So we are going to have health promoters within the communities at risk as well.
At the risk of being redundant, I really want to underscore the enormous progress that's been associated with dealing with the issue of the epidemic, if you will, in the context of people who use needles, inject themselves with drugs, using needles. Had we not had the ability to move forward with that program, there's no way we would be where we back to think about prevention works. You know,
Absolutely.
organizations had to be established in the private sector because the district was prohibited from being able to use our dollars. It helped us get started in the city, and then we finally were able to work with the Congress to remove that as a rider, which never should have been imposed. We've now been able to institutionalize it as a part of our, you know, our detection, our prevention system in the city. 80% reduction in the last, you know, 10 or 12 years. Absolutely phenomenal, almost everything. Thank you all very much.